The message arrived through encrypted channels on a Thursday evening in December, sent by a Palestinian doctor working in a field hospital in Gaza who had managed to access internet for a few precious minutes while treating patients by flashlight during another night without electricity. And when Ronaldo read the carefully typed words that had been composed during brief breaks between emergency surgeries, he realized he was receiving not fan mail or our quest for autographs, but a desperate plea from someone whose circumstances had forced them to reach out to anyone with global influence who might be able to amplify voices that were being systematically silenced by people who preferred their violence to remain invisible and their victims to remain nameless in international discussions that treated Palestinian suffering as abstract political problems rather than immediate human emergencies requiring urgent intervention. The doctor who had written the message was named Layla, a 32-year-old surgeon who had completed her medical training in London, but had returned to Gaza to serve her community, despite opportunities to build a comfortable career in Europe, where her skills would have been well compensated, and her safety would never have been threatened by airstrikes that targeted medical facilities, with the same indifference that they showed towards schools, mosques, and residential buildings where families slept peacefully until bombs transformed their dreams into nightmares that too often became permanent, because survival was never guaranteed in a place where death could arrive without warning from directions that civilians could not predict or defend against. Layla's message began with an apology for contacting someone she had never met, but her words revealed the desperation of someone who had exhausted conventional channels for seeking help and was now reaching out to anyone whose platform might bring attention to conditions that were being systematically ignored by international media that preferred to focus on political analysis rather than human impact of policies that affected millions of people, whose stories were rarely told with the detail and empathy that their suffering deserved. And her decision to contact Ronaldo represented a last resort from someone who understood that celebrity voices often carried more weight than expert testimony when it came to generating public attention and pressure for policy changes that could save lives. The details that Layla shared painted a picture of medical practice under impossible conditions that challenged everything Ronaldo thought he knew about healthcare and the basic infrastructure that civilized societies provided to protect their most vulnerable members. With descriptions of performing surgery without anesthesia because medical supplies were blocked from entering Gaza, of treating children's injuries with makeshift equipment that would have been considered obsolete decades ago in any properly equipped hospital, and of watching patients die from easily treatable conditions because the medicines and equipment that could have saved them were prevented from reaching medical facilities by policies that seemed designed to cause maximum civilian suffering while maintaining plausible deniability about intentional harm to non-combatant populations. The specific cases that Layla described included a 7-year-old boy named Omar who had been brought to her field hospital with severe burns covering 60% of his body after an airstrike had destroyed his family's apartment while they slept. And despite her best efforts with limited supplies and equipment, she had been forced to watch him die slowly over 3 days because the specialized burn treatment and pain medication that could have saved his life were not available in Gaza due to blockades that prevented essential medical supplies from reaching healthcare facilities where doctors like Layla worked miracles daily, but could not overcome systematic barriers that made life-saving treatment impossible, regardless of their skill and dedication. The letter continued with descriptions of medical colleagues who had been killed while treating patients, including Dr. Ahmad, who had been performing surgery when his hospital was bombed, and Dr. Fatima, who had been targeted by a sniper while transporting medical supplies between facilities. Their deaths, representing not just personal tragedies, but professional losses that reduced the already inadequate medical capacity available to treat civilian casualties, that increased faster than depleted medical staff could address with equipment and supplies that were never sufficient to meet the needs of a population under siege, where every day brought new injuries and deaths that could have been prevented with proper medical intervention. Layla's message reached its emotional climax with her description of a premature baby girl who had been born during a bombing campaign and who had died because the hospital's incubators were not functioning due to power outages that lasted for days, while fuel shortages prevented backup generators from maintaining life support systems. And her account of holding this tiny infant during her final minutes, while the baby's mother wept and asked why her daughter had to die, when incubators were working perfectly in hospitals just a few kilometers away in Israel, where medical care was abundant and reliable, because geographic location and ethnic identity determined access to life-saving technology that should have been available to all children, regardless of their parents' nationality or religion. The plea that concluded Layla's message was not for money or medical supplies, though both were desperately needed, but for something more fundamental and challenging. Our quest that Ronaldo his global platform to speak about what was happening in Gaza in ways that would make it impossible for people to claim ignorance about civilian casualties that were being dismissed as propaganda or exaggerated claims rather than documented medical emergencies that were killing children whose deaths could be prevented. If international pressure forced policy changes that prioritized human life over political considerations that seemed to value some children's lives more than others based on criteria that had nothing to do with their innocence or their right to medical care. Ronaldo's response to Layla's message was immediate and comprehensive, beginning with a public statement that shared her account of medical conditions in Gaza while protecting her identity to prevent retaliation against someone whose courage in speaking out could have resulted in her being targeted for harassment, or worse, by people who preferred their violence to remain undocumented and their impact on civilian populations to remain hidden from international scrutiny that might generate pressure for accountability and policy changes that could reduce suffering. The medical supply initiative that emerged from Layla's message involved working with international humanitarian organizations to identify ways to get essential medical equipment and medicines into Gaza, despite political obstacles that had previously prevented such assistance. And while these efforts faced significant bureaucratic and political challenges, they eventually succeeded in establishing channels for medical aid that reached facilities where doctors like Layla could provide better care to patients who had previously suffered or died from lack of basic medical resources that were readily available in neighboring countries. The scholarship program that Ronaldo established provided opportunities for Palestinian medical students to complete their training in European universities, where they could develop skills and expertise that would be valuable when they returned to serve their communities. And this program recognized that building medical capacity required not just supplying equipment, but also ensuring that qualified professionals were available to use that equipment effectively, while maintaining their connections to the communities they were committed to serving, despite opportunities to build more comfortable and lucrative careers elsewhere. The advocacy campaign that grew out of Layla's message focused on raising awareness about the impact of blockades and military actions on civilian healthcare infrastructure, with Ronaldo using his platform to speak at international forums where his celebrity status gave him access to audiences that rarely heard first-hand accounts from medical professionals working in conflict zones. And his presentations included Layla's descriptions of medical conditions alongside statistical data that documented the systematic degradation of healthcare capacity that affected entire populations rather than just individual patients. The foundation that eventually emerged from this correspondence became a comprehensive program that supported medical professionals working in conflict zones around the world, providing not just financial assistance and equipment, but also advocacy for policies that would protect medical facilities and personnel from military targeting that violated international law and humanitarian principles that were supposed to ensure that medical care remained available to civilian populations, regardless of political conflicts that might be affecting their regions. Layla's continued correspondence with Ronaldo over the following months provided updates on conditions in Gaza and the impact of the assistance that had been generated by his advocacy. But more importantly, it offered insights into the psychological toll of working as a medical professional in circumstances where politics determined whether patients lived or died, where dedication and skill were often insufficient to overcome systematic barriers to care, and where hope had to be maintained despite daily exposure to preventable suffering that challenged faith in human decency and international commitments to protecting civilian populations during armed conflicts. Years later, when some of the medical supply channels had been established and were functioning despite ongoing political obstacles, when several Palestinian medical students had completed their training and returned to serve their communities with enhanced skills and international connections, when Ronaldo's advocacy had helped generate broader international attention to the healthcare crisis in Gaza, Layla would reflect in her messages that reaching out to him had represented a turning point, not just in her ability to help her patients, but in her understanding that individual voices could create change when amplified by people with platforms and influence who chose to use their resources to address suffering, rather than simply accumulating more success and recognition for themselves, proving that sometimes the most important medical interventions happened not in operating rooms, but in moments when someone with global reach decided to speak truth about injustice that others preferred to ignore.